Fasting Ramadan exposes the diabetic patient to major complications. If you have diabetes and if you wish to fast, you must follow some guidelines to keep safe during Ramadan. A pre-Ramadan consultation with your doctor should be done 1 or 2 months before Ramadan, in particular to adapt the treatment if necessary. Self-monitoring blood glucoses should be performed several times a day during Ramadan. If you fast, main risk is hypoglycemia. Hypoglycemia can lead to ketoacidosis, which could lead to coma or even death. If you have hypoglycemia, you may experience sweats, tremor, palpitation, anxiety, brain fog, or even stress and nervousness. But what can you do if you have hypoglycemia? You should self-monitor your blood glucoses. If your blood glucose is below 0.7 gram per liter, you have hypoglycemia. Then you must immediately break the fast and take sugar, such as 3 pieces of sugar or half a can of sugary soda or a glass of juice. You should also rest for a few minutes, and 15 minutes later, you should self-monitor your blood glucoses once again. If the situation doesn't improve or if you have any doubts, you should call for your doctor or the emergency. Be careful. Some sweet ingredients do not make the blood glucose rise fast enough, such as chocolates, biscuits, fruits. These nutrients do not cure hypoglycemia. Another risk during Ramadan and during fast, especially, is hyperglycemia. If you suffer from hyperglycemia, the main risks are thrombosis or dehydration may lead to coma or even death. How can you recognize an hyperglycemia? Some people may not feel any sign, but if you suffer from hypoglycemia, you may be deeply thirsty, have a dry mouth, pee frequently, have a blurred vision, or even an intense tiredness. In this situation, what should you do? If you have one, you should self-monitor your blood glucoses once again. If your blood glucose is above 2.5 gram per liter, you have hypoglycemia. Then you must break the fast immediately and hydrate yourself with water. Tea, coffee, soda, or fruit juice may increase your dehydration and are not advised. It is also advised to see your GP as soon as possible, and if the situation worsens, you should call for emergency. The way of life often changes during Ramadan and can lead to diabetes complication, as we said earlier. You will find some advice to keep safe during Ramadan in this video. Even more than usual, during this time of the year, you must listen to your body and your symptoms. If you have any doubts, as I said earlier in this video, don't hesitate to call your GP, your doctor, or your pharmacist.